A 23-year-old woman comes to the hospital to deliver a full-term infant. Labor is complicated by amniotic fluid embolism, and subsequently blood tests show the presence of the fibrin spilled products. The next day, the patient abruptly developed anuria, gross hematuria, and flank pain, accompanied by the rapidly increasing blood urea nitrogen and creatinine level and a new cardiac fraction rupture. The patient ultrasound demonstrated hypodensities with the renal cortex. Which of the following is most appropriate treatment? So the patient is giving birth, and during the labor there occurs some amniotic fluid embolization. That amniotic fluid enter into the blood of the mom, and there occur some embolization. So we know that embolization also causes some sort of vascular obstruction. Okay, but in this case there is an evidence of the presence of the fibrin spilled products. It means there is occurring some sort of coagulation, and there is occurring some sort of coagulatory and anticoagulatory processes happen in the blood vessel. So after the labor and after the amniotic embolization and after placental abruption, a common disorder and a common pathology that is occur in most patients, that is the disseminated intravascular coagulation. So disseminated intravascular coagulation, we can see most of the patient after amniotic fluid embolization and after the placental abruption. So it is the condition in which there is a formation of plaque. There is a formation of some plaque at the various side of the body vessels. So in this condition there is obstruction of the vessel, which leads to infarction and necrosis of the different organs. So if you look in this condition, that the next day the patient abruptly developed anuria. Okay, the patient has anuria, gross hematuria, and flank pain. It means that the infarction or the problem is with the kidney. Okay, accompanied by the rapidly increasing in the blood urea nitrogen and creatinine. So blood urea nitrogen and creatinine shows that the renal function is not okay now. The kidney, they fail to perform its function, and a new cardiac friction. I will explain why the new cardiac friction after when I complete some other points. The patient ultrasound demonstrate hypodensities with the renal cortex. It means that the renal cortex now undergoing a process of infarction. So there is no specific point, there is no focal infarction. It means that the renal cortex, the whole cortex is involved. It means there is a diffuse cortical necrosis due to the accumulation of the clots and the thrombin into the various part of the kidney blood vessels. So there is a diffused cortical necrosis. In this case, the patient is suffering from diffuse cortical necrosis. When diffuse cortical necrosis occurs, there is a kidney infarction. The both kidneys stop doing its work, so there is no urine output, there is a hematuria and high level of creatinine and blood urea nitrogen. And this blood urea nitrogen, okay, and the accumulation of the urea into the blood leads to many other complications. For example, uremic frost, uremic pericarditis, uremic gastritis, and many other neurological abnormalities. It also cross the blood-brain barrier and disturb our neurological processes. Okay, so the new cardiac fraction demonstrate that the patient now have some sort of precardial pericarditis. Okay, the patient now having some pericarditis. So this pericarditis is due to urea. So we can say it is the uremic pericarditis. So the patient condition is very bad in this situation, because there is a diffuse, there is the first disseminated intravascular coagulopathy, then this diffuse cortical necrosis, which leads to increase in urea, blood urea, creatinine and hematuria, and which leads to pericarditis in this patient. So which of the following is the most appropriate treatment? So aggressive fluid support. If you think about that, if the patient is given more fluid, the kidney is already not working, so the fluid just what it happened, it increased the intravascular pressure, it further make the condition bad, it is not good. So biopsy to elevate the malignancy, no need of the biopsy, because there is no bacterial or no autoimmune mechanism, it is just diffuse cortical necrosis. Broad spectrum antibodies, no, because there is no bacterial infection. Dialysis, yes, we can think about dialysis, because the patient both kidney is not working. Once the both kidney not working, the urea is start to accumulate into the condition into the patient, because it crosses the azotemic state. When azotemia, okay, we can say that the patient we can treat the patient with some medications, or it is not necessary in that condition, but the patient one undergoes the urea, okay, uremic syndrome, uremic disorders, uremic diseases, okay, for example uremic pericarditis, as I said. So the patient need dialysis in order to eliminate those waste particles. No treatment is necessarily at the time. This is absolutely wrong. So the option that is very specific in this condition is dialysis. We need a dialysis in order to make the condition of the patient good, in order to save the patient. Thank you.